reception is so bad down here. It won't let us verify.
See, I don't have it. I can get on because I don't have one.
It was working fine the other day. Today it's just
Stephanie streaming this?
Yes.
Okay.
Yes.
All right, well, I didn't want to start until we knew for sure that we were confirmed there, so let's go ahead and get started. Welcome.
Yes, thank you. Thank you for having me today. My name is Megan Skaggs. I'm the Executive Director of Shawnee County Medical Society Health Access Program. I'm proud to share that we celebrated our 20th anniversary this year. So we, since 2002, have been serving residents of Shawnee County to access for healthcare, prescriptions, and a number of other things that are involved in our program. Since then, we have actually had enrolled in our program 16,923 unduplicated low-income uninsured residents. So that was as of this morning. I'm real excited to hit that 17,000 mark pretty soon. Hopefully in the next month or two we'll see. But what Health Access does is we combine donated physician care, hospital services, dental care, optometry, and medication assistance in a coordinated program that's led by our medical society. We are actually one of only 4 counties in Kansas that offer programs like this. We actually now for the first time are working alongside with our counterparts in Sedgwick County, Johnson County, and Wyandotte County. And so we're trying to see how we can make things better, not just for our counties, but throughout the state, and look at some expansions and some big things on the horizon. But that's probably a few years off for some things that we want. But for the last 20 years, our goals have really remained the same, to have access to health care for low-income uninsured residents of Shawnee County, to increase health equity, and provide efficient coordination of our physician volunteer services within both hospital systems and all of our volunteers. So we focus mainly on preventive care, and we work alongside all of the safety net systems in Shawnee County. We actually have about 70% of our patients have their primary care at Grace Med Primary Care Clinic. We also work with Pine Ridge Family Care, and the mobile clinic is a new offering that Stormont Vale has rolled out this year that we have quite a bit of our patients now are working with the mobile clinic. We also have patients that have primary care at Vallejo, and then we have a number of private physicians that donate their services as well. So once enrolled in Health Access, patients have access to donated specialty care, dental, optometry, and our medication assistance. What we do is we recruit specialty physicians and we monitor referrals to make sure that these referrals are spread out evenly across our volunteers throughout Shawnee County. This year, we've actually reached, for the first time, over 350 physician volunteers, provider volunteers, I might say. We've actually enrolled quite a bit of mental health providers this year because there's been a big need for some of our patients. So we've been working really closely with some of those providers to provide therapy and other type of things. Patients are eligible for Health Access for 6 months at a time. They can enroll as many times as they need to as they're qualified, but we just have to screen them for their income every time that they re-enroll. So they have to be within 150% of the federal poverty guidelines. If they have Medicare, Medicaid, private insurance, then they're also not eligible for Health Access. So these are really for those people who fall through the gaps in our system. Health Access patients must reside in Shawnee County. And like I said, be within 150% of that federal poverty guideline, which for 2022 is $1,699 for a household of 1. And if you have a family, household of 4, your income must be under $3,469 for the month, or previous 4 weeks. This morning, we had 1,578 patients enrolled in Health Access, and we average about 1,575 to 1,600 each month. Over the last 20 years, we have recorded over $224 million in donated health care. Blue Cross Blue Shield donates their services to quantify that dollar amount for us. Our goal is to work and assist that working poor. So these patients don't qualify for a state medical card because they make too much, or maybe they make too little, and they also don't qualify for any of the Affordable Care Act benefits, again, because of that income. 77% of our patients are under 100% of the federal poverty guideline, and 58% of our patients are female, many of which who are single mothers. The vast majority of our patients reside in the zip codes of 66605, 07, or 08. We work closely with the rescue mission to make sure that those patients are getting the care that they need. Again, our goal with our preventive care work and prescriptions is to keep patients out of the emergency room. We screen our patients when they re-enroll, and we ask them a number of survey questions, and 92% of our patients report they have not visited the ER in the previous 6 months, and 90% of our patients report that they believe that they are getting well and staying well due to their enrollment in Health Access. So our access to prescription care and specialty care keeps people out of the emergency room. Year to date, we have actually received nearly 381 emergency referrals, which is actually 50 more referrals from our hospitals than last year at this time. So most of our our emergency referrals are going to come from the emergency room. They're going to come from patients who are admitted due to diabetic complications, a COVID diagnosis, heart attack, stroke, those types of things. That's what we consider our emergency referrals. Once we get that, we do what we can to get those patients enrolled right away, so that way they can, number one, get access to prescriptions, they can get their care donated, and they can get access to a specialty referral if needed. One of the pieces of our Health Access program is our partnership in the LINK program. So LINK stands for Listening to Your Needs, Identifying Your Goals, Navigating Your Community, and Keeping You Healthy. It is a partnership between Health Access, Stormont Vail, Vallejo, Harvesters, and the Washburn School of Nursing. We started this program, we're on year 3 right now, we're about to enter year 4. That program, almost in its entirety, is funded by the Topeka Community Foundation. The funds that you provide help, the Shawnee County Commission provides, will fund our prescription program, so everything except that prescription program is funded by the Community Foundation, but all the prescriptions are funded through the access that you guys give us. And so we actually, just 2 weeks ago, finalized a really fantastic video that the Stormontville marketing team put together for us. So instead of me explaining to you really how it works, I figured I would show this video, because I don't know if there's a better way to show it than learning directly from one of our patients. So here goes.
The LINK program is a partnership of different agencies within the community. It is a partnership with Vallejo, Stormont Vail, Health Access, Harvesters, and Washburn School of Nursing.
The LINK program really targets individuals who are falling through the gaps. So these people traditionally, obviously they're not going to have any type of health care. They normally don't have any type of services. There's a large number of LINK patients who will end up qualifying for Medicaid or disability, and they just don't know how to start that process. A number of them are homeless. They're living at the Topeka Rescue Mission, or they're just living on the streets. And so once they become involved in LINK and they're eligible, these community support navigators will go out to wherever they are.
Describe myself as a very nice person. I help people, out if they need it. And I do a lot for people, for my family.
The LINK program has helped Elnora with social determinants of health in so many ways. We really have addressed everything within the social determinants of health. When I first started working with her, her health, especially her diabetes, was not managed at all. It was a newer diagnosis. She had no education. She wasn't aware of how to properly take care of herself. At that time, she was what we call couch surfing. She would stay at a friend's house for a few days and then, just kind of move around. And we learned very quickly that it was not a good situation, not only for her physical health, but for her mental health. So I was able to talk Elnora into going to Topeka Rescue Mission.
The mission helped me out, with a lot of my feelings. It made me, appreciate people a little bit more because, never know where you're going to get help from or need help.
One of our goals in addressing Elnora's social determinants of health was getting her housed. She needed the stability. There was so much that she could benefit from being housed. She could not afford to obtain housing. And so thankfully, when COVID hit, it opened the doors to a lot of resources. And one of those were a housing voucher. And with that, it would allow Eleanor to obtain housing, and she would receive assistance in maintaining that housing.
Ashley's been a big help. I feel that one for her, ain't no telling where I'd be. I had a lot of issues when I started, working with her. She's helped me out. Link program helped me keep my medical appointments. They helped me get food from pharmacists, helped me get my prescriptions, they helped me get Medicaid, and they helped me get rides to and from the doctor. Homelessness, my health was bad. I was spending, every other month or so in the hospital because of my conditions. Well, not them at the time, but Ashley has been a big help to me.
For potential funders or current funders for the LINK program, what I would want them to understand is how important this work is and how important it is to focus on the quality of the work that we're doing and not the quantity. We have had times in the LINK program where we're only working with 7 or 8 patients. But when those 7 or 8 patients have such a high need for services and high need of support, what those support navigators are doing in improving their lives is drastic.
The LINK program is important because it helps a lot of people. It helps them with financial aid, it helps them with food, it helps them with utilities, transportation, all of that. So I feel it's very important. Take advantage of that program. Let it work for you.
So that is our LINK program. Health Access serves as the lead in the LINK program, and so we do a lot of the coordination between the agencies working together. A lot of patients, Elnora went on to qualify for Medicaid and disability. Not all patients in the LINK program will, but those support navigators work with the patients to go through the application process of all of those things. So what I am here today to do is to ask you to continue funding the Health Access prescription program. Physicians believe that prescriptions are critical to success of the program. You have someone who maybe comes in as newly diagnosed with diabetes, knows that they have to have medication, but they have no way to afford to pay for it. And so when they get enrolled in Health Access, we're able to assist them with a $7.50 copay. Without access to these prescriptions, patients are unable to utilize the care that they get to stay well or get well. Most of our prescription funds are sent for seizure medications, diabetes, high blood pressure, antibiotics. The parameters for the prescription program are that it must be a generic prescription. We don't cover any over-the-counter medications like Tylenol, no narcotics. The pharmacies that we work with do not charge a dispensing fee, so we're able to maximize the use of that funds. And then, like we said, it's a $7.50 copay. We have a $1,500 per year maximum per patient. We were able to increase that. This last month, I think that we were able to increase that. We had a $1,000 maximum, but we looked at our records and look what was happening. We had a couple patients kind of right in a row call me and say, I've hit my max, I don't know what to do. And they're in crisis. There's really no other ways anywhere else for them to turn once they hit that $1,000 max. We were able to work with our prescription formulary company and look at, we only had 7 patients in the last year hit that $1,000 mark. We had some wiggle room in our funding, and so we decided to increase that to $1,500. We're talking about that little number of patients that just seemed very reasonable to us, and it's going to help pull those patients out of crisis mode. We do have a The Health Access Management Oversight Committee has a prescription subcommittee, and so we look at our formulary quarterly, we look at ways to reduce expenses, sometimes we look at specific drug classes, and we make alterations when necessary, like increasing the amount that we are able to provide per patient. Prescription costs are incredibly important to our patients, so the continued funding is really more important than ever. I want to thank you for the ongoing county support that we've received over the years. We're asking again for $110,000 for our prescription funds, and that level has stayed the same since 2019. The city of Topeka also helps contribute to that, and we receive about $47,500 from them each year to help with our prescription program. We work with, like I said, we work with both hospitals, Stormont Vale and KU St. Francis, and getting patients connected with specialty physicians, and especially when they're in the emergency room or inpatient care. We are a partner in the Efficient Safety Net System in Shawnee County. We work closely with Grace Med, their navigators there, to help patients apply for Affordable Care Act Marketplace. And then also you saw our Link navigators and the work that they do with patients. The need for health access continues, as health is a community-wide issue. It impacts the ability to work, stay employed, take care of property and family, and be overall productive citizens of the community. Prescriptions help keep people out of the emergency room, which when the ER is used unnecessarily, it's going to drive up the healthcare costs for everybody. Just to conclude, we've recorded over $224 million in donated care over the past 20 years and assisted nearly 17,000 patients. So if you have any questions or anything I can help clarify, please, I'm here.
All right, any questions?
Sure. Thank you, Mr. Chair. Megan, can we go through your budget? Now, there's a couple things I want to highlight for the commissioners. And we're going to start with, you have prescription assistance city, $42,750. And then you have Topeka City Council, $3,750. Then you have prescription assistance county, $102,500. Shawnee County Commission, $7,500. Why do we have those broken into two different categories, prescription assistance and then just city county? Yeah,
the prescription assistance subcategories, that goes directly towards our prescription funds, and that's what that's used for. Those two other subcategories are a small portion that we set aside for operational expenses.
Okay.
So that's why they're broken apart like that.
And that's where you come up with the $110,000
Yes.
for the county and the $46,500 for the
Yes.
city. Okay. Then, as we go down on your chart, you have a new line this year for state of Kansas.
Yes.
And you have $25,000. And I may have just spaced it out because it's right
Nope,
after
that's
lunch,
okay.
but can we talk a little bit about the grant you
Yes,
got?
yeah. We worked, like I said, we're working together with our partner agencies in Wichita and in Sedgwick and Johnson County. And it was about a year ago at this time that we joined together. We had a lobbyist that worked closely with our Wichita counterparts that said he would donate his time to our agencies to see what we might be able to come up with as far as requesting funding from the state. And so long story short, we went through a long process of asking the governor for funding. We did receive approval. We haven't received the funds yet. We met today and we have no idea what that, the state doesn't even know what that looks like, but we did receive approval for a one-time $250,000 grant from the state. And so we are looking at spreading that out to help with our operational expenses over the next however many years we're able to get out of that. COVID hit us pretty hard. We had about 25% reduction in grants that totaled up over the various funders that we've had. And so the timing for this grant to come in and help with our operational expenses was really huge. And so that's kind of what we're looking at now, is piecing that money out per, I guess, budget year to budget year.
So just a couple of follow-ups on that. Where we have 25,000, well, first, the 250,000, was that just the health access here in Topeka, or is that 250,000 be spread between Wyandotte and Sedgwick?
Nope. It was $750,000 split three ways. So our portion is that 250.
Okay. So then from, again, I am not an accountant,
Yeah.
nor do I play one on
Yeah.
TV, but if we look at the 25,000, that really should be looked at more as reserves
Okay, yeah.
250,000 that you're using then to space out over 10 years.
Right, yes.
Okay. I just want to make sure that it's clear that you actually have 250,000.
Yes, sorry.
Not 25,000 one time.
Right,
Okay.
yes, yeah.
Um,
And again, that is, we still, I will be, just to be very clear, we don't know what that is gonna look like. That is our intended use with that money. What the state says we can or can't do with that money, I don't even think that they really know yet. Like I said, we've reached out to KDHE. That fiscal year started July 1st. The money's coming from KDHE, but they don't know how, what, when, where, or why.
So from a Shawnee County's perspective, Shawnee County should probably pump the brakes on cutting any assistance to health access because you haven't actually gotten
Right,
the money yet from the state, nor do you know what strings there may be tied to it.
correct,
Okay, so it's something to note for the future.
yeah.
Okay.
Mhm, absolutely.
And then the final thing is, typically, we have a huge fundraiser for health access, what the doctor ordered
Yes.
music.
Yeah.
But we, COVID kind of put a cramp on those 2020, or
Yep.
2020 and 2021, which
We
affected
did-
your
yes.
fundraising.
Oh, yeah, tremendously. In previous years, I've been with Health Access now. August, I'll be with Health Access 2 years. Before I came in, we were able to raise anywhere between 15 and 20,000 from that fundraiser. We had to cancel it once COVID hit, and then 2021 was a really, I think, that was a really, we tried to revamp it because of COVID. We tried to do this, we tried to do that and pivot. And I have to say I would say it was a failure. You know, we budgeted, I think, about 15,000 for that fundraiser. I think we raised about 3. So that was really disappointing. Now this year we did just have our annual fundraiser in April to celebrate our 20th anniversary. And we were able to raise a little over $9,000. So I'm hoping that year to year, that will regain that momentum that we had before COVID had hit, but we're climbing that track slowly.
That's all I had.
Yeah, no, thank you.
Mr. Chair, this money you got from the state, was it COVID related? Was this like ARPA money or anything?
Nope.
But it was just a one-time fund?
Yeah, the governor, when she added that to her budget, she did make it very clear that she intended for that to be a one-time only.
Good. I had a question about your referrals. You get them from the hospital emergency rooms, you get them from, do you get them from Vallejo or, and rescue missions?
Yeah, they can come from anywhere.
And Grace Med?
Oh, yeah, absolutely.
And anywhere else? Are there?
I will have to say we're working more and more closely with Manor Inc. I don't know if you're familiar with them, but they have a lot of different arms. They're a recovery house. They work with, I don't know if parolees is the right word, but people who are recently, because I don't know if they're out on parole or if they're just out of prison. But they work really closely with that type of services. They have a program called Work for Success that if you've ever been incarcerated in your, 5 years ago incarcerated, 10 years ago, you can enroll in this Work for Success program. And it's a 10-week program that really just, it's almost like a life coaching course. I think they receive state funding for that program, but we're working more and more closely with Manor Inc. and that set of population as well.
Do you work with our Shawnee County Jail when you have people?
I would say not the jail so much as post jail. You might say there is the Shawnee County. The name is escaping me right now. We meet quarterly, and I just joined this, so that's why the name is escaping me. But we meet quarterly to discuss how to help, people who are recently released from prison and what services are available and where do they start? How does this work? And it's a group, like I said, meets quarterly, and we're working a little bit more closely with them lately.
This could possibly dovetail in what our event we had earlier this morning, where they received a check at our jail to help these ladies as they leave jail. To a lot of them just have the shirt on their back and whatever they wore in, and but I could see where getting hooked up
Yeah.
to get drugs or whatever they might need, prescription drugs anyway.
We work with a little bit with the discharge planners there, and so I do have connections there with them, and they have our application, and they kind of know, okay, this is how this works, and we do have a tentative plan in place. I don't think we've got very many of those applications actually turned in, but the plan is that, they can even apply for health access while they are still incarcerated, and then we can date their enrollment for the date of their release. And so we do have some of those plans in place to help, yeah.
The genesis for health access is that it served as that gap between individuals that make too much money to qualify for state assistance, but not enough money to be able to qualify for health insurance. So you had a gap of people that were right there in the middle, and if you were looking at diabetic insulin or the test strips, they could be outrageously expensive if you were trying to fund it on your own, as opposed to working through health access where you might be able to pick it up at a very economical fee. And it's, again, to provide that gap, and it's to provide that assistance between too little and too much.
Okay. All right.
And the primary goal is to get patients enrolled in primary care. That really is the centerpiece of our program. So if you have a sore throat, if you are feeling like you're, whatever you might be feeling, you know who to call. So you're not just saying, oh, I'm going to wait, I'm going to push that off, and then you end up in the emergency room. You have established primary care, so you know who to call when you need a physician or a primary care.
All right. Any further questions?
No.
All right. Thank you.
Yeah, thank you.
All right, let's go ahead and get started. Sorry about that.
No problem. Good afternoon, Commissioners. Nelda Henning, Director of Facilities Management. So here's a quick mission statement for facilities to efficiently and effectively provide safe, clean, and comfortable environment for all public and departments to operate and conduct business of Shawnee County. I wanted to give you a brief overview of our staff. We have Brent Smith, who is the building supervisor for the North Annex. Don Bill is the building supervisor for the Health Department, all 3 buildings. We have added Kelly Reed as a maintenance tech 1 here at the courthouse this year. We have a custodian, Mercedes. She has been with the Law Enforcement Center almost 11 months. She was our first full-time custodian. Connie Anderson is the custodian for the courthouse. She has been with us going on 10 months now. Austin Anderson joined us in the last 45 days. And then we have temp agency staffing. Marcus Hayes is with the North Annex. Odessa Ross is at the 10th Street Health Department location. Nancy McConnell is at the J.P. Lewis building. Larry Stone and Ian Riddle are here at the courthouse. And I do have 1 open position at the elections office. I do want to make a note that Marcus and Odessa have reached their hours required to transfer over to county staff, but they've decided to stay with the temp agency just because of their situation financially. I wanted to also note the facilities that we serve: the courthouse, the North Annex, the health department's 3 locations, the election office, the extension office, the law enforcement center, Old Fire Station 5, Manor Conference Center. We provide support to the Stormont Valley Event Center, and we will be taking on the new County Administrative Services building here shortly. So with my proposed budget, in the last year, we added 6 full-time custodial positions. As I mentioned, of those 6, 3 are filled. We are looking at splitting the contractual services out line by line to be a little bit more accurate with what's going on, because we have the temp agency, it's a line item on the budget, along with the contract services for lawn care, so that we can split it out and get a little bit better idea of where the money is going. And if you look at my budget, there's a number of increases and decreases because of splitting out and trying to get a better idea of where everything's going. And those are reflected as each line item. We've added a couple of new memberships, which was different from the past. Then the addition of the in-house custodial, we've had to bring in supplies in-house too. I've added cartograph fees, even though I haven't had a chance to really get into cartograph this year. That was one of my goals last year, and I'm hoping that over the next few months we can get that going now that I have staff positions kind of regulated out. And I'm asking to reclassify 2 positions. I do have an open electrician's position. I can't justify filling that position because I just don't have the need for an electrician in the courthouse. And I know that wasn't a county electrician position. If the county feels the need for one, I think it would be better served under a department that actually utilizes them more than I would. I'd like to reclassify that to a maintenance 2 position. I'm sorry, a maintenance tech 2 position, mainly because I know we don't make positions for people, but Kelly came in as a maintenance tech 1. He's definitely proven to be more qualified than what we've given him credit for, and I'd like to open the position up to give him the opportunity to step up. Plus, that gives me the opportunity to start building the staff, that if someone comes in as a maintenance tech 1, they can look at the future of maybe becoming a maintenance tech 2, and then stepping into a building supervisor's position, hopefully in the future. Both Dawn and Brent are to the point where they would qualify for retirement if they so choose to do that, and I just don't have anybody in the ranks to fill those positions, and we need to start working on that. Then I'd like to reclassify a maintenance tech 1 position to an office assistant 2 position, mainly because the service level I'd like to provide to these facilities would be that someone's there to answer the phone, or someone's there to answer questions, or someone's there to deal with situations. Right now, that someone is me, which takes me away from other duties that I really need to be doing other than answering the phone or trying to direct staff or track down people. I do still have still do have open positions. There's 3 open custodial positions, the building supervisor at the courthouse position, and I have an intermittent custodial position, which is the one that usually would cover the elections office.
Before we go on, Mr. Chairman,
Oh.
sorry to interrupt, but if we can go back to that. The maintenance tech position, how much of the maintenance tech is just general handy person experience versus maybe designated more towards plumbing?
What we are running into is some plumbing, some maintenance, some mechanical, some electrical. A maintenance tech 2 is going to be a little bit more certified and able to do different tasks than a maintenance tech 1. Maintenance tech 1 is basically a beginning position. They would be under a maintenance tech 2 or a building supervisor to learn systems and to learn how to deal with situations. Right now, we are actually, Austin Anderson, even though he's listed as a custodian, we have him supplementing as a maintenance tech 1 type position so that he can start learning and he can be an assistant to Kelly, because I can't have just one maintenance tech. It's just too much for one person to handle. We're hoping that we can get Austin to the point where he can start taking on some of the maintenance duties with the possibility that he could step into an open position as he gets to that point. But we needed the body. He is doing custodial work part-time and doing maintenance work part-time as Kelly needs assistance. So it's more specific. We need plumbers.
Okay.
We need HVAC techs that can deal with HVAC issues.
When we created the electrician position, the idea was to get away from being contracted out for an electrician and having an electrician that would be able to float among the whole county. And so that electrician they might be over at Department of Corrections working on electrical work, or they might be at the Public Works Department. They would be more floating, able to be accessed by the entire county department and not just in one capacity. And so instead of creating a maintenance tech 2 position, and I'm just asking, why wouldn't we advertise to fill a master certified plumber, because they will have HVAC and plumbing certification, or they may have, if we had the opportunity to have a HVAC certified, plumbing certified individual, wouldn't that have more value to the county? Right now, when we have plumbing issues, we contract out with McElroy's or one of the other entities.
Yes and no. I do know that there are open HVAC technician positions in the county that have not been filled, so we would just be adding to that, where a maintenance tech would be a little bit more rounded and not have to have specific certifications, but if they had certifications, that would be a bonus. For me, and I can only speak for me because I can't speak for the other departments that have used the electrician in the past. In the last year, I have made 2 phone calls for an electrician. And for plumbing, yes, the larger issues like the plug drain we had last week, that required special equipment that we didn't have, so we called in someone for that.
And I'm not debating about the moving away from the electrician at all. I agree with that. It was one of those things that I think that we had a need at that time, but once the electrician, if they do their job right, once the job is done, it should not be a reoccurring need for the electrician. And there was quite a bit of electrical work that needed to be done at one time. Now it seems like we have a lot of plumbing work that is coming to us. And the reason I ask and kind of go around, and I don't mean this to be disrespectful to you and the work that you do, because it's much valued, but right now you're probably our highest paid plumber. You may be the highest paid plumber in Shawnee County. And
I don't do plumbing, but that's one thing I don't do.
or maintenance all around.
Yeah.
Because I know that you're all hands on deck and fixing issues as they arise.
Only
and-
because I don't have the staff to do it.
And I agree with that. And so I'm wondering, do you go with a maintenance tech too, or do you go directly to a plumber, since that's what majority that we have?
I see your point. I just, there's so many other issues. And I know that once we get under the renovation project, a lot of the issues will either be opened up and be able to be fixed, or will be resolved with the project. I can't even begin to describe how much benefit to the courthouse this project's going to be. And I'm excited about it getting started, more so probably than anybody else, because it will help immensely with some of the issues that have been Band-Aided over the years. So at this point, I think that, I mean, we do have plumbing issues, yes. We have minor electrical issues. We have HVAC issues. But like I said, a lot of those will be resolved, or will be opened up to where they can be resolved with the project that's coming up.
Well, I mean, if you were to go back another slide, we have 1, 2, 3, 4, 5, 6, 7, 8, 9 facilities in Shawnee County that you have managed by 4 people. And then some temp staff.
It's tough. It's been a tough year. It's been a very educating year, but it's been a tough year.
So,
And I think overall, I don't think many of the facilities would come back and say that they don't feel like they're getting the service they need. They're getting the service. Could we do better? Yes, we could. But that's where I say, I think if we had another maintenance tech, he'd be a maintenance tech 1 or maintenance tech 2, it would definitely take the workload and be able to spread it out a little bit more. But you have to understand, the North Annex is carried by Brent, and when he needs help, we support, and the health department's carried by Don, and when he needs help, we support. But the rest of them, no, it's carried by this building.
well, and what that doesn't count is that it's not also counting the weed department,
That's what I was just about to mention.
and it doesn't count the.
We've had that discussion. We're not quite
and-
sure if he falls underneath me or not.
And in Public Works, they have a couple of other
Yeah.
buildings that's outside of the North Annex. And you're also consulting with Tim Laurent, with Parks and Rec, and all of the buildings they have when they have issues that arise.
Yeah.
So, anyway, I'm sorry to get us off track, but I just.
No, that's
I wanted
fine.
to
That's-
ask about the maintenance tech while it was,
I mean, a plumber would be nice, an electrician would be nice. Those specialty type fields demand a higher pay scale than what we're offering. The only thing I can offer as a maintenance tech is the opportunity to get the certifications, because we will cover those costs. But once they get the certifications, we can't justify a pay raise. They're on the scale with everyone else. So I don't think we could bring somebody in at this point with what we're offering.
okay.
Do we have any kind of on-call plumbing and electric services?
Yes, we do. Electrical is through Torgerson, and plumbing and mechanical and some minor construction is through Central Mechanical.
Okay, and is there like a threshold of like, if it's under a certain amount, we call them, otherwise it's got to go out for bid, or?
I think it still follows the purchasing guidelines.
Okay,
The biggest expense we've had recently was the sewer line on 4th floor, 3rd floor. That ended up being quite costly, just because it was after hours and emergency. I couldn't get a hold of Central Mechanical, so we had to go a different route. But I think we have it resolved.
Well, that elections office rain guttering leak, that was costly as well, $15,000, and sucking all the water out of the carpets and fans, and, that was $15,000.
and they got a pretty good deal on it. I mean, it could have been double that.
Yeah,
Yeah.
it could have very easily. And we're still negotiating on the roof, is my understanding.
So,
The trade service agreements is really meant for the day-to-day repairs, emergency situations, that kind of thing. Anytime there's a project that would require, any of those services, then it really is part of the purchasing policy, whether it goes out for, RFP or how they handle that. But
I was just thinking about the situation that you described to me earlier with the server room.
Oh, the condensation line?
Yeah, and
Yeah,
and
the
that
drain
kind of
plugging.
thing. Is that like we call on-call services, or is that something we're handling in-house?
We're actually handling that in-house currently,
Okay.
yes. That is something that's within Kelly's abilities, and he's taking care of it.
Okay.
But it's actually multiplied now into other things, but yes, he's going to take care of all of it.
But like in a situation like that, if she can't handle it in-house, since that's pretty much an emergency situation, they would go with the on-call,
Okay.
on-call trade.
I think in the last year, the only thing that Nelda hasn't had to deal with is a raccoon dropping into her office. Right, Bill?
I'm familiar with that project. Firsthand.
The other thing is that office assistant, well, I see the need for it. Those are hard positions to fill.
I understand.
It seems like that's
They are.
one that we've got a lot of vacancies, and it might be tough to fill that. I don't know if it might be better to get the maintenance tech one and just give them a phone.
Well, and
One of the, can I butt in just real
Sure.
quick? One of the things she didn't mention is our office currently is doing all financial stuff for her office. And we've been having to fill in for their inability they're the only department who has us doing financial stuff for them.
because I don't have a backup. Also, with everyone moving out of the courthouse, wow, I get to take on more duties because there's no one here to monitor what's going on in and around the courthouse. I'm going to be taking on the surplus room. I'm going to be taking on the mail. I'm going to be taking on the vending. So all this stuff, kind of the peripheral stuff that's handled by the departments that are currently in the courthouse, when they move out, it's falling back on me because I'm the only one left. And it's just adding to my workload, which an office assistant would be awesome to have, just to start carrying some of that, to have the backup for the financial end, to be able to handle when certified mail comes in, to be able to kind of be the gatekeeper of all the deliveries and all the other issues that other departments are handling currently. Because we haven't set up 707 to be anything more than just an office space for staff. It's not going to be a quote, public building except for on days when we need to have public access to it. So,
All right, we stopped you midstream. So
well, you stopped me. This was my last kind of, here, we'll catch up with what's been going on for the past year slide. Before I go in to talk about my capital improvement requests for the next 5 years. I didn't know if you had any questions on my budget for me, or if you wanted to talk about what I would like to see in my capitals. Go ahead.
I think we're good, go on.
So one of my requests is to replace the restroom partitions. You're looking at me going, why? Well, I know for a fact that the restroom partitions on second floor are being held together right now with screws and a hinge because the doors are falling off. The restroom partitions down in the basement, at least in the women's restroom, are ceiling hung and they are not staying hung. If you go down, you can either get in one or the other, but you can't get in both without some major work. So the toilet partitions in the building all need to be replaced or updated and fixed and made usable because they really haven't been touched since they were originally put in. Another item is to replace the roof over the extension office. They had a major leak, I don't want to say leak, but a major failure this year. We patched it. We had to do some internal repair work for walls, ceilings, and carpeting. And that was the upper level and their office level. We replaced almost all of the ceiling tile in their reception area because of the water roof leak. So I would recommend their roof getting replaced as soon as we could possibly do it. Then general lighting upgrades from the Manor Conference Center in 2024. There was some work done on them by the former electrician. It was not really done correctly, so we have some LED lights in old T12 boxes, and the rest of it is still like T8 lighting. It would be nice to be able to go in and update the lighting, just the general lighting, to an LED type system like we're doing here in the courthouse, so that we can get better overall lighting in the building and get it on a more efficient system than what it currently is. And then in 2024, 2025, replace the courthouse landscape and irrigation. With the project, we're going to be tearing up most of the yard around the courthouse, getting the lift up to get the windows replaced and to do the work around, in and around the courthouse. Plus, the irrigation system, currently only about a third of it functions. That's why we haven't ran it for the last year, and I'm not planning on running it this year, because I don't want to repair it and then have it torn up with the project. So once the project's over with, I think we're going to need to go through and kind of update, clean up, and repair the landscape and irrigation system around the courthouse. In 2025, the courthouse roof will be reaching the end of its life. Plus, with the project, we'll be taking the condensing units off the roof that feed the Liebert units in the IT server room. When it moves down to the basement, it will be getting a new system, and those condensing units are actually going to be put on the ground, and we'll, as part of the landscape project, landscape around them so that you don't see them from the street, but they'll be more accessible. But by taking the condensing units off of the roof from the Liebert units, we'll be having holes and other punctures in the roof that we would be needing to look at getting repaired and the roof replaced on the main courthouse. And then my dream project, which I'm hoping that we can put money aside each year towards, is going in and renovating the bathrooms throughout the courthouse. If I was to get the partition project, that would also lead towards renovating the bathrooms. The bathrooms have had cosmetic updates, but I will tell you that we are having some issues with the plumbing in the building, in the general areas, that will need to be addressed one time or another. And I think that if we start accumulating the money and work on them at one or two at a time over a few years, we can get them resolved.
Excuse me.
Okay.
The partitions, is that a separate
It is.
request? I don't see it.
Oh, it was a separate
In our
request. I
list.
thought I put it in.
Okay, we'll have to get with you on that, because
Okay.
I see the restroom renovations, but I don't see the partition
Partitions.
project.
Okay.
How much was that?
I was thinking it was around 70,000.
Okay, we'll have to get with you on that one.
Now, a couple of questions, Mr. Chairman, if I can.
Yeah, please.
Currently, the health building, the J.P. Lewis building, it has some water issues with the roof, or leaking issues?
No,
No?
it's condensation.
Okay.
What was thought to be a roof leak is actually condensation. And they're trying to monitor and figure out what's causing the condensation to form. Usually condensation forms because the pipe isn't insulated or the insulation's not correctly installed. And Bart and Don are working on trying to figure out where exactly
Okay.
that is occurring.
And then the elections office, you had said they're still working on trying to figure out what they need to do as far as the guttering and the,
So the last proposal that they have was to replace the gutters as is. The roofing contractor that has the warranty on the roof feels that the tie between the gutters and the roof was not done correctly because they reused existing gutters. They're proposing to go in and to remove the existing gutters, which need to be removed anyway, they're failing, and redo the tie-in and put new gutters back on, and then enlarge the downspouts. That's the proposal currently. And that would not void the warranty that's on the roof. That's good for another, I think, 11 years.
okay. And then the courts in their presentation made a request for backup generators.
We are looking, IT and facilities are looking at whether the generator we currently have can handle the capacity to add courts onto it. We both feel it can, because we have to do, with the modification to the current IT server room, we think that we can add their needs onto the current generator. We're looking into it.
So that they may not need.
They may not need it. We're hoping that we can get
Okay.
it.
And so that would maybe put a little asterisk on our CIP list for that.
Yes.
Yeah.
All right,
That's a hope we will be able to eliminate that one completely.
Yes.
I think you said you needed to do a load test.
They did a load test when they came in and did this year's
Okay.
maintenance on it. And so Mark and I kind of talked on the side. We haven't had a chance to dive into it. Because of the IT server room and some of the IT things getting modified with the project, he thinks the load's going to reduce enough that we can put theirs on with what capacity we have left.
and then the courts also had in their CIP request the restrooms on the third floor at 55,000. And there was a question about whether that was already part of,
That was not part of the original project, no. It is in the current set of design development drawings. I don't know if it's an alternate we're looking at to consider at this point. To answer your next question, yes, it would be more cost-effective to do it while we're working in those areas than it would be to come back in later, because of having to do underfloor work, which then it results in doing work underneath, on second floor. The good thing is the areas where that restroom is proposed is an area that's not going to be renovated. It's an area that's going to be left vacant for the time being.
and that's the IT server area.
It's actually a little to the west of that, but yes.
Mr. Chair.
Yes.
Another item that came up with the courts was the rewiring.
And we are looking at that too. Mark and I talked briefly about that this morning. And we think we can get that in with the IT wiring that we're going to be doing as part of the project.
Yeah, Mark was saying a lot of that will have to be rewired for IT anyway. And the fiber has, multiple strands, and hopefully courts could just, have some of the strands. And so we would not have to do duplicate projects on that, so that might take care of that project, that CIP project also.
Yeah, with the IT server room moving downstairs, there's going to be a fairly large rewiring of the building.
So, and again, just while we're on these projects and talking about these projects, typically we would allocate $1 million for contingencies. Moving into a new building across the street, 707 Quincy, I anticipate that there will be things that happen that we don't anticipate. Something will not work the way it was supposed to work, or something will fail. It's just inevitable for any new
The
renovation or
shakedown, the
new
shakedown period, yes.
as you're getting used to a building. Is the $1 million going to be sufficient, or should we set aside maybe a little bit more this year where we would have the financial ability so that if the elevator stops working because there's a motor that fails? That's the one that I would worry about first and foremost, is that you're now using elevators where the elevators haven't been used regularly for a while.
Well, actually, they're getting used quite a bit right now, but I know what you're saying. Yeah.
So,
I feel very comfortable and confident, especially since Cindy is going to be over here working. They're proposing that this project over here is going to be 14 to 16 months, that we will have ample time while they're here to be able to address any issues at the Administrative Services Building, and keep the projects going and we still have the warranty period. So like you said, the elevator going down might be one. An elevator is $125,000 to $150,000 if we had to go full in on it. So, if you're looking at that and you're worried about it, it might be worth it, but I have a comfort level, we should be fine.
okay.
Now, on the Manor Conference Center LED lighting, is that a retrofit where we can pop out the old fluorescent lights and just
They're all
put in an
2x4s.
LED panel? Okay.
And
then
the LED lighting, like what we're proposing here in the courthouse and what's going in at 707, is a universal plug, so it doesn't matter if it's a 120 or 277. So the light fixtures can just drop in and plug and go.
Okay, and we would be using basically the exact same thing over there?
That would be my recommendation.
Okay, and this would be for all of Manor Conference Center or
The
just
common
certain
areas.
areas?
The common areas.
Okay, so I was at an event a while back in, not the big ball, not the Sunflower, but the one across the hall that has the stage. and the stage lighting was awful. You couldn't see anyone up there. They were just in the dark. And is that something that this is going to address as well?
No, this project is for general lighting. If you wanted to tackle the stage lighting, that would require a designer to come in and really sit down and design it to where it does what it needs to do, not just general task type lighting or access lighting. That is a very specialized field, and if it's something you want to address, I'd be willing to look into it, but it was not on my radar currently, just because that's not an item that has been brought up to me as an issue other than what you have said. I know Manor has been much happier with some of the things that we have been doing for them, but they haven't mentioned anything about lighting at this point. But I
Okay.
did want to address just the general lighting because we have two different systems happening over there, and we really need to get in and clean it up and make it one system that is working holistically for everyone.
Okay.
I did find your request for the restroom partitions for the courthouse. And just so you guys are aware, I'll send you something that you can actually score later for that. But it's $60,000 in 2023. Sorry.
I thought I'd sent it.
Yeah, it's here. It got assumed it said bathroom.
Oh,
Bathroom and bathroom looked like a dupe. So we got it, sorry.
Mr.
one's a
Chair.
little bit more immediate
Yeah.
because I'm waiting for the door to fall off again, than the general just bathroom
I've
renovation.
seen many, usually little kids, when they go into that bathroom, think they're locked in. And so they scoot down on the floor and scoot out underneath of it.
Oh, yikes. Okay.
And
Commissioner Rippon.
Then it's
Then it's locked from the inside.
Go ahead.
This roof replacement on the extension office.
Yes.
What kind of roof's on there now?
It's a single ply.
Okay.
Seems like all our county buildings have single ply, and they're all failing at about
Have
the
we
same
ever-
time.
Have we ever considered putting metal roofs on these things?
Oh, I'd love to. I'd love to do
I know they're
it.
expensive, but man, they last.
Oh, they're 100-year roofs.
They're 100-year
Yeah.
roofs,
You
and it
pay,
seems like
you
every
pay
20
about
years-
double, but you'll get 100 years out of it
Every
unless.
20 years, we're throwing another roof on all these buildings. and,
Yes. I actually worked for the state of Kansas when they went in and retrofitted all of the KDOT buildings went from flat roofs to pitched standing seam metal roofs
we
because of the
did one
cost
at,
effectiveness.
It was Rice Community Center. We put a metal roof on there, and that was over 20 years ago. Great shape, yeah.
Mhm.
And,
I mean, if you're willing to do it, I'd be happy to, because to me, that's the best way to spend the money. I mean, single-ply roofs are on because they're inexpensive. Let's face it, they're inexpensive, and they last 5 to 7 years. You get 5 to 7 years of money out of it.
We're in this.
But metal roofs, if you can do it, that is definitely the way
It
to
just seems
go.
like we're very happy in the United States of building a house or a building that's supposed to last 100 years and put a roof on it that lasts 20.
Well, I will tell you, my two favorite roofs outside of standing seam metal would be the stone-coated steel, which is a metal roof, or Da Vinci shingles. And when I was at Washburn, we put Da Vinci's on almost everything.
And what are the Da Vinci?
Da Vinci's are actually, they're recycled plastic
Oh,
shingles
I've
that
seen
look
those.
like slate. They're made in Kansas City, so they're local. They take the old 2-liter bottles and press them into shingles.
I was just wondering about those with the UV light over the years breaking down. But,
I will tell you, I was questionable about them until, I don't know if you remember that big hailstorm we had, probably 6, 7 years ago, where the hailstones were the size of softballs. People were telling me those hailstones were hitting the Da Vinci's and just shattering. Da Vinci's weren't even touched. So, if you want to spend the money, Da Vinci's are well
I
worth
put the
the effort.
stone-coated metal on my roof at home.
Stone-coated steel is great.
I'll never have to touch
Nope.
it again.
Nope.
And that was 15 years ago or so.
Yeah, stone-coated steel are considered 50 to 75-year roofs. Da Vinci's are 75
I
to
think it was
100-year roofs.
guaranteed for 75.
Yeah.
It was just.
Yeah, they're phenomenal. But you have to be willing to spend the money.
All right, we are out of time.
What was your total budget request or increase?
My total budget request was $1,041,000, which is an increase of about $200,000, I believe.
increase of 42,655.
Oh, it's more than that.
No, it's, yeah,
Yeah, and one
it's
thing,
about almost, it's 180,000, basically.
So I'm looking at the worksheet.
one thing that we need to, that
Read the
it
heading.
complicates this, and
It's not
when
on
we
there.
had the cleaning services,
Mhm.
each department paid their own bill to the contractor. Now that they're all under in-house, right now, they're all the salaries are being included under her budget. So we need to,
The expenses currently are under her budget.
well, right,
The
right,
budget is not under her budget.
yeah,
Yeah.
yes.
For
It
this
wasn't
current year.
budgeted, it didn't change the budget, but all of their expenses, all of their salaries and everything we pay to the temp agency is all hitting her budget as an
Correct.
expense right now. And so if you look at this, and if I include all of those salaries in her budget, then the increase, that's where you get the 42,000. If it's something that we want to split out those costs and charge each of those departments like we have in the past, then we would need to change that and do an internal charge to those departments.
Let's just say the last year I've been grateful. I've been a little short-staffed because I've been able to float my budget. But if I get the staffing I want and the staffing that I feel the county needs, it's gonna be a little bit different story.
So what's the total budget request? Is it still the 1,000, or 1,041,000?
It is.
Okay. I just-
And that is including, and when I'm looking at, what I call like a flat budget, it includes all of the salaries for 2023. So the majority of her increase, the majority of it is all in salaries.
Yes.
The 42,000 would just be what she's asking for above the,
A lot of
The
that
salaries.
is, a lot of that is the equipment that she needs for those staff. I mean.
But those are the salaries of the newly created positions
Positions.
Yeah.
also.
Yes.
The 6
So it's a
custodians.
26% increase though over last year.
yes, correct.
Okay,
I kind of like it all under one umbrella. I don't know how you guys,
Well, I think,
you're the ones that have to break it
I
out.
think you
again.
want them all to report to her. Because to me, the most efficient way is for her to be able to move people around as she needs to, cover certain areas as she needs to. Like she said that, Brent and Dawn, if they need help, they go help them. If she needs help here at the courthouse, they come in and help. So I think that is the most efficient way now.
I mean, while Mercedes was on vacation, one of the staff here went up and covered for her at the law enforcement center. And we were able to work that out.
In order to charge each of those separate buildings for that, you'd have to be making, internal charges back and forth. And I don't know if that's something that is really of benefit to us.
Considering the majority of those people are general fund.
Sounds
Yeah.
like busy work.
Yeah, that would be my concern. We don't want to create work that isn't of benefit.
okay.
Thank you.
Thank you, Nilda. on
It's been
down.
nothing but uphill from there.
No, and yes, I have no toilet tales to tell, but I could probably make some good ones up. Well, I am here to present our 2023 request to the county. We are asking for an overall slight increase. The increase is only 0.28%, and that increase is being requested by Sheltered Living. So this presentation is to present for Sheltered Living, for Capper Foundation, and for TARC. And TARC and Capper Foundation are requesting level funding from last year. And I can go into as much detail or as little detail as you would like with respect to what we've done in the past year. We are continuing to be very grateful for the support from the county, not only with respect to the monies that we receive from the annual budget, but significantly for the support that we receive with respect to our fundraising efforts. We're back at the golf course. Now that COVID's been past us, for the last 2 years, we've been back active with our golf tournament, and of course, Winter Wonderland, which has continued to be our largest and almost our only big fundraising event now of the year. So without your support for that event, we would not be able to raise the over $200,000 a year that we are able to bring in from Winter Wonderland. But I'm happy to discuss any of the programs. Capper, Sheltered Living, and TARC are the only not-for-profits in this work in Shawnee County. And therefore, those are the three entities who annually make this request. We all do similar work. TARC is different in that, in addition to serving adults with developmental disabilities, we also are the Tiny K program for Shawnee County. So we serve all of the individual children and their families who are identified as having a developmental delay or at high risk of developing a delay. So that is sort of what sets us apart in terms of why our numbers are so much higher than the other two entities. But what Sheltered Living is seeking the additional funding for this year is they transport the folks who live in their residential programs to their day services programs and out to community activities, both during the day and on weekends when they have them at home all weekend long. And because of the increased costs of gasoline, et cetera, they are seeking additional funding for their transportation program.
And that's the increase of $2,786.
Yes, yes.
Just double checking.
We have been able to make some significant increases to our direct support staff salaries in the past year, both because of some funding that came, bonus money that was awarded from the state, federal dollars that came to the state, COVID related. So we were able to give our direct support professionals increases in terms of bonuses, signing bonuses, but also an increase in the Medicaid reimbursement rate for HCBS services allowed us to provide our staff with a significant increase in their starting salaries. So we're hoping that 2022, the rest of it, and 2023, we're going to be able to retain more staff and keep our folks in services and not have to be sent home again for COVID-related illnesses. That was our plague in 2021, as so many of you have experienced with the opening and shutting down of services. We have been able to remain open consistently throughout.
Great. Any questions?
No.
All right. Well,
Thank you.
that's it.
I guess.
It's
That's
very
it.
easy. Thank you very much.
Thank you so much.
Thank you.
You guys want to start early? We got 3
We can.
minutes. All right, Mary,
Thank you.
let's get started.
All right, a little early, yep, yet another break then. Mary Thomas with Community Resources Council. I gave you old-fashioned paperwork. I could do a PowerPoint, but you're probably sick of that stuff by now. And so I'll just take it in order in what you have, which would be the Shawnee County Advocacy Council on Aging, which is all senior programming, and kind of the lion's share of where the social service money for the county gets directed in the first place. Attached is that lovely spreadsheet that I do for you every year. And if you just move to the right 4 columns where they're colored, you can see what they asked for initially, what that percent of change was to what they had been awarded the previous year. Then the yellow is what the committee recommended after they went to work and read their documentation. As you know, I produced that 4-inch to 5-inch notebook for each one of them that would just, it kind of wears them out, but they're diligent about it. And then the final column, kind of the, whatever that is, pink, is then the ultimate percent of change from award in 2022. There are always a few organizations that no matter what I tell them, they're going to go for the moon. Because they always ask me, what's the cap, which that's a lovely question. I tell them there is no such thing. But I ask them to think about their programming, build the budget around the programming, what they are projecting of business to do for the next year, and then, flesh it out with their budget narrative and so on. Don't just put, 60,000 out there and then build to it. Build your budget first and work towards that. So those that took a haircut, if you will, from their ask are typically those that tend to round up. And all of these agencies this time around, finally, post-COVID, if we're there yet, we're able to make a personal presentation, and a few came in by Zoom instead because of logistics or illness. So most of them took advantage of that, and they do like to do that. And then they stand for questions from the committee based upon budget review, looking for how did the numbers turn out the previous year and so on. And they get worked over pretty hard, but they do a fine job. So you can see the recommendation. There's really no surprises there. A few did not put in, so that's marked as NA, but otherwise it's pretty much the group you're used to seeing. Those are the agencies that are active with the Shawnee County Advocacy Council on Aging on our monthly meetings. And I will pass to the next unless you have questions looking at that spreadsheet.
Any questions on that?
2, friendly visitors wanted out or didn't make a funding request.
They did not make a funding request because they have retired that program
And
last
then
year.
Rossville, they've been pretty consistently funded, well, 2020, 2021, they weren't. But they did not make a funding request for 2023?
They did not make a funding request, and kind of the reason why is they heard the last 2 previous committees loud and clear that I also reinforce that if they're just looking for budget money to pay the city for the building and utilities, they need to take another look at what they're doing. If they don't have programming, if they don't have seniors in their center, the committee is not interested in funding your rent payment and your electric payment. And they have a wonderful building there, and I've been there several times trying to encourage them on programming. They would come to a few meetings and listen to other programming, but for whatever reason, it's the city clerk that generally is there on behalf of the agency, and I'm not sure how much of that message goes back.
Isn't that the same issue we had several years ago with Auburn?
Correct.
In which there was no programming that was actually, it was a meal center, but not actually programming.
Correct. And so they ultimately just faded away. They are, well, if they would attend at least 2 meetings during the course of the year, which is the only criteria of the agencies that apply, that they need to be at 2 of the Advocacy Council meetings that are held 10 times a year. If you don't have those 2 meetings under your belt, you really can't apply unless they make some sort of special request to the voting members of the council. So, yes, Auburn faded away and they've not been back since. If they wanted to reappear And I don't get the sense that they've reactivated in any way, but I'd be happy to look it up if you want to know.
I just bring that up for Commissioner Ripple, and I know that's in his district.
I was gonna ask.
And in case there was a question about why Auburn was not on there.
Yeah, and Rossville unfortunately may be falling in that direction. By them not even making any application either here or in the social service side, because I always run the council first, so if they miss a deadline or something's happening, or they can't meet the 2 meetings requirement, they can file after the fact and the second round of programming in the regular social service side. And Rossville successfully did that a couple of times in the last 5 years, but I think they had heard what the different committees were telling them, and so far I don't think they've been able to produce what they've been asked to. I don't even think they're a meal site anymore, because during pandemic, meals were being delivered. They weren't coming in for those at all, so they're not a conduit site for meals either.
And Catholic Charities, they've fallen off, it looks like.
Yes, that was a senior program, and during pandemic, they sunset that program, and I thought they might have a comeback, which may be next year, because they're not ready. That was all run by volunteers, primarily senior volunteers, doing those phone calls and checking on folks, and they could not sustain that from people working from their home. Records would be, distributed and stuff like that, and they didn't want that happening.
And Let's Help, they had a 150% request change.
Yes,
That's a pretty hefty.
Yes. They're kind of on the comeback through a series of executive director changes. Their programming is strong, but they were really having some trouble meeting guidelines and deadlines for this particular grant. They got it together. Their ask was a little hefty, so it was pared back by the committee.
Habitat for Humanity, obviously, I'm familiar with Habitat, but I'm not familiar with the Aging in Place program. That was a substantial increase as well. Could you kind of explain what they're doing there?
Yeah, their executive director always appears in person. She has turned that program upside down. It's wonderful to watch that work. All of that program came about through this funding availability. She takes every dollar that she gets from the county and matches that several times over throughout the community and throughout the region. Specifically, this programming is to assist seniors in their home. They have to be a homeowner this time, which is not hard. A lot of seniors are in aged homes, but they can't get on a ladder anymore to clean their gutter. They're not exactly sure who to hire because they're so afraid of being, part of a con scheme, which is more prevalent with seniors anyway. They also need assistance with maybe changing plumbing because of aging, different things they need to do. Work on the home is all that this is done, and they do it by cost only, and then they go out and get those match funds. It is a means test. I can't tell you exactly what that is, but it's pretty low on the scale as far as qualification, and then they try to stretch that money as far as possible. I think she testified that it was over 60 homes last year that they had assisted. About 2,500 to 3,000 or so is the average, but they do an assortment of things, whether it's minor roof repair because of damage, guttering, soffits because of water. It's mostly to eradicate water damage, to stop then the evasiveness into mold, and really will run people out of their home much faster than anything else.
Yeah. Okay, great. Any other questions?
The committee really likes that program too, by the way. That's why they didn't really have much problem with what the ask was. Her
Yeah.
numbers were strong.
Sounds like a good one.
It is. It's one to model after. So moving on then to general social service funding for the county. Same way the spreadsheet works, but of course, different organizations, different amounts. Some of those are duplicates of what you saw in the senior programming, but they're very good about making sure that there are bright lines around the funding, different cost centers or pots of money, however you want to refer to it. And then I look over those budgets pretty carefully to make sure that I feel comfortable there's no cross-pollination on the money, so that they're not moving things around and using, senior funds for regular social service and so on. Generally, their ask, if they have senior programming, is the bigger ask on that side of the line. So you can see the committee got busy. There was a few new programs. There was a few that did not request. And I can answer questions about some of those holes in there if you have specifics you care to know about.
Well, Topeka Youth Project, I know they have a brand-new executive director. Was that the reason they didn't apply, or?
I would love to be able to say yes. However, I personally gave them a off-the-books, pretty good extension after Judge Eberts and I discussed this particular problem, and they chose not to.
Okay.
I was hoping their golf tournament went well, but I have different report to that, so they maybe just can't get it together. However, we've got a plan B if something doesn't make it there.
Okay. Because I know that, they also move locations, and there's been just a ton of transition there.
Yeah,
so.
it's kind of been a pinball thing going on there, but I think they're trying to settle down.
Okay.
They have one really strong board member, the vice president over at Heritage Bank, and he's trying to help them still work through the transition. If they make it, great. If not, we'll work the net.
Okay.
That's kind of part of what I think we're supposed to do on behalf of the community and the commission as well.
Okay. Any other questions on this?
This percent of request is a little higher than the last one. We were at 5% over previous ask, but this one's 8.4. There was an awful lot of good programming, and it was really hard for the committee to sharpen their pencil much more, but of course, you'll let me know if we need to get back to work on that at a later date. The new programming caught their attention, and they wanted to make sure that they didn't leave them out, I think is how we got a little bit higher there.
Mr. Chair,
Yeah.
Sunflower
Mm-hmm.
Inc., that STEM activities, what is that?
That is it's all education at any age from, early grades like second grade and so on to up to graduation. At the later years, they do extensive tutoring to either kind of get kids over the hump to get that certificate diploma or to help them get ready for college testing. The other is to help kids with reading issues, math issues. There's one-on-one tutoring that has a sliding scale. She also has a voucher system. This money will be used for that voucher system for those that can't quite afford the tutoring. She also has STEM projects this summer, every Wednesday afternoon into the evening through June and July. She has a 4-hour STEM opportunity. She had 2 in the spring. And both times she brought out the folks that are associated with NASA from Forbes Field. They did flying for the first one where they built rockets and actually flew them. They went really high, only I know because I took my granddaughter. And the second one was robotics. And that was as equally interesting and challenging, about a 4 or 5 hour event. So she's really all about kid education and trying to cheapen that down as much as she can to help kids who are stuck for various reasons to make sure they've got momentum.
Thank you.
Got some good programs that are been developing out there as a result of pandemic or seeing the need.
So it looks like there's a couple of them on here that have not applied in a couple of years. Are they going to fall off the spreadsheet after a while, or?
Yeah, I keep them, I only pull the last year off as I put the new year on so that there's continuity with the total. Because if I were to remove them, then the total would, would be off. I could put the correct total, but then if somebody did the math, that they'd say, she can't add, which on some days I can't. But I can, let's see, JAAA, I know they didn't apply because they have been blessed with good money on various fronts. So she had other funds that she could use for this opportunity. It's not that it's gone away. In fact, they're building that program. It was new last year, or I guess this year. So they'll be back as things start to level off when the flood of money from DC starts to dry up. And that's also true, I think, of a couple of these other, but I knew her specifically because she and I chatted about it, Susan, over at JAAA.
Okay. Any other questions? Betty, Jennifer? All right.
The last one is just kind of the catch-all, that it's a high-end look at what we do. Again, as I've told you before, most people don't know us, and that's fine, 97 years. We just plug along. One of the things that I would like to point out, in case there was any concern, is over time, working with these agencies, I've sort of felt like part of what our mission would be, certainly on behalf of the constituents, the public, and the county, would be to help those agencies that are in trouble. Sometimes whether they know it or not. I have a lovely relationship with your finance department. If somebody can't get their requests in and they're holding up, closing the books and so on, sometimes I'm the worst offender, but they'll let me know. And then I call, yeah, they know. I call those executive directors, and I'll tell you what, that paperwork is in about 24, 48 hours, which also makes me get my paperwork in right away too, because sometimes the press of business gets you a little unfocused on your calendar. So we work closely with your department here to make sure everything is copacetic. If they feel someone's in trouble, they'll let me know. If they receive inquiry that if it's not anything to do with what they're doing, they'll send it right to me and I'll take care of it. So as I figure out that an agency's in trouble, and so case in point would be Keep America Beautiful, because I think you might be wondering, we have, through no fault of whatever they were doing, who knew that their new executive director was going to have a medical incident that, in liken of a stroke, that absolutely took her completely out of the game. It's a volunteer board. There was only one paid staff. You know, they're sucking air like no tomorrow. And I talked to Bill, right? Solid Waste. Anyway, we met a few times and we just stepped in. I said, you know what? We're just going to come in. We'll work the net. We're going to take care of this for the next 6 months. We'll pay the bills. We will keep track of what's due. We will make sure that the reports are done for grant work and so on, so that you don't miss opportunities. We've worked with him on the KAB budget because we know that's part of his overall budget. He feels, not that I want to speak for him, but he gave us the indication he was quite comfortable for another year to move forward. I'm giving that board a good 6 months or more to kind of unwind this thing and really focus on what they're looking for in the terms of a part-time executive director, and then get out in the marketplace and find it, figure out what they can afford, what the budget's going to look like. But, you know, we're just going to work that net and hold everything together until they're ready to step back out on their own. And we've done that for some others that we've talked about before. And I have another that I'm kind of watching because I may have to do that as well. Not whining about it. I think that's what we need to do for those that are very relevant in the community and are strong otherwise. Some maybe need to sunset, and I'm not trying to be, you know, breathing life into something that's already dead on arrival. But for those that are strong and something out of the blue has just taken them out of their game, we're right there to pick it up and give them time to get reorged and move forward.
One of the things, too, that Mary has really helped on, as I have gotten different emails on different, started out with CARES Act money and then with ARPA funds. As I have gotten notifications, I forwarded them on to Mary, knowing that she can then distribute that out to organizations so that, you know, they're at least aware of these opportunities, and that's been really helpful.
Right. We have about 3,500 agencies in our communication network, so that stuff goes right back out that Betty sends to me. And when it's specific to like aging, I make sure it goes immediately to those executive directors as well, rather than just your random e-blast that they have to sort through their inbox. Probably a final note on what CRC is doing is we're enjoying our growth at Lundgren in Oakland community. We still have a few spots open, but they're large rooms. They're 1,100 or so square feet respectively. It's going to take the right tenant for that, and I'm not too concerned about it. And apparently 501's not concerned about it either, because they approached me 2 weeks ago about a third building. jaw-dropping, let me just tell you. I was not expecting that request at all. But it's a great location. I take the compliment that we must be doing things right for them and making them look good. Maybe they're making some money too, heck, I don't know. But I talked to my board and we've agreed, so we will have a third location at Stout Elementary on College, a half a block from 21st and Washburn University. They are still working to remove their items from there because most of that's getting packed and going to Highland Park Elementary and a few other places, so it may be end of year before they really kind of got it bare to the walls, if you will, to turn over to me. But I'm already talking to some agencies who love the location. And there are a few that are bursting at the seams. And again, in this post-pandemic atmosphere, I think they might be ready to edge out a little bit out from their comfort zone and see if they can't reach more of the community that needs their assistance. So we'll be replicating our empowerment center there at some
Great.
point.
It's fantastic.
So no grass is growing under our feet.
Sounds like a good use for that building.
Well, they mentioned, because I was like, really? Because they just had kids through there in May, but they said because it's that flood zone that's never going to change, they've decided that they better not invest any more, income there and rework their situation. For one thing, they couldn't build a storm shelter as a result of flood zoning. So it just kind of, grew from that. And the board decided to do something different. But the NIA is pleased, so I guess it'll work out.
Good.
Anything else I can do or answer for you?
Anything else? No, I think we're all right.
Well, as always, those agencies on this, on these two spreadsheets truly appreciate your support. I can't tell you how many times I hear them throughout the community talking about their support of the county with their funding. They use those county funds as their cornerstone, if you will, to match money almost every time. And if they're not, and I can tell by their budgets, I'm on them. It's like, you need to use this and get out there and mine for some more money, because this is kind of a gold standard. If your county supports you, then you've been vetted, you've stood the test, and you need to get out there and look for a little bit more to go with it, along with your fundraising, which every one of them does individual fundraising. We make sure of that as well. So your money goes a long way by the end of the day. It's not just the dollars on an annual basis in this budget.
Great.
Enough said.
All right.
Gentlemen, thank you so much.
Appreciate it.
Seriously, if there's
Different animals.
Okay, so I'm Kathy. I am with Helping Hands Humane Society. I appreciate you guys letting us come down here. Particularly, it gives me a break from the chaos that's happening over at the shelter right now with all the animals. So we submitted a request for 2023 for $145,000 in support from the county. And I have no doubt that all of you understand the importance and vital role that the shelter plays in maintaining the health and safety of our community through disease control through these animals, as well as aggressive dogs and cats. Clearly, we don't want running around out in the county just biting and potentially spreading whatever diseases are out there. And the shelter has worked with worked with the county for years, and we hope to continue to do so. So for 2023, we are projecting 1,100 animals on average coming in from the county. For those animals coming in, we've denoted a figure in there for the 3-day hold period. For the 1,100 animals comes out to a total of $146,223. So that's a total per animal of $132.93. For the shelter to house and care for and maintain that animal for that 3-day hold period. Of course, there are some things that we would not charge the county for in that time period, including like medications. Obviously, we get a lot of animals that come in that have either been hit by a car or injured in some fashion, who need medication, be it pain medication or immediate intervention with our veterinarian to save their life or at least make them comfortable until after that 3-day hold period is up. And then our veterinarians can choose the option necessary for that pet. So anyways, the shelter does hope to continue our relationship that we have with the county in the future. So this is our request for 2023. So I'm happy to answer any questions that you have.
Any questions?
The 1,100 animals that came from the average of 2016 to 2021?
Yeah. It actually averages a little bit higher than 1,100. If we just did the past 3 years, averages 1,148.
Okay.
So.
That was going to be my question. I mean, that's a pretty broad spectrum, and so I didn't know on this year if we were really seeing an uptick or just the same average amount.
Well, the beginning of this year has been the same. Generally, the majority of the animals from both county and city are going to come in beginning now with the 4th of July, probably for the next couple of months. So that's where we will see if there is like a significant uptick coming in. So it's hard to project from the first part of the year.
Okay.
I was in there yesterday. There were a lot of animals. It looked pretty full.
There are a lot, yes. There's 554 in care of the shelter right now. So that is a tremendous number, and it will continue to rise.
That's all yet.
All right. Any other questions? Bill?
None.
No?
All right.
Okay.
Well, that was easy. Thank you.
It's the arrows. So. All right. Okay, well, good afternoon, Commissioners. Teresa Fisher, Director of the Health Department. I will be presenting today's budget presentation for next year along with Edith Gaines, our Finance Officer. So just a couple of things before we get started. I did bring quite the team today, so I want to take just a couple of seconds and introduce. So Edith Gaines is our Finance Officer. We have Amanda Neosy, who is our accountant. We have Melissa Mindor, sorry. I started calling Missy. She is our newest leadership team member. She is the Division Manager for Family Health. We have Craig Barnes, who's Division Manager of our CHOP area. And we have Carrie Dels, who's Clinical Services Division Manager. So the team behind me, along with many other program supervisors and managers, is who put the budget together that you're going to see today. So we feel confident that based on where we're at right now and our anticipated needs, it's as accurate as can be. Knowing that things change, though, that's always the variable. I would also note that as a whole, we are continuing to look at operational efficiencies. I'll talk about that in a few more slides, the effectiveness of our programs and kind of where we see things going. So this is our current organizational chart. I know it's kind of small, but you will have received a full-size copy of this. The biggest change to note is that last year at this time, we had a fifth large square there, which was our infectious disease division. So when we had our infectious disease division manager have a different career opportunity that they left for, the leadership team met and really strategically tried to think about why this division had been put together to begin with, and that was in response to the COVID pandemic. And where we saw this fitting in, knowing that COVID wasn't going away, and what our needs were to our community and how to respond. And so the decision was made at that time to actually take it apart from being a full division and instead make it a program. And so we merged that under our Clinical Services Division, which is Carrie's division. It fits very well with communicable diseases. So the contact tracing, the case investigation, it's all things that she's very used to doing and falls under her purview as it is. So that is where that ended up lying. So they live under there on the org chart, but they're still housed at our Gage House location. We also moved our epidemiologist under the Clinical Services Division. And again, that was done with the discussion of this team and really the work that the epidemiologist did, and feeling like it really fit well based on the data that she's reviewing, the data she's looking at, the things that we need her to help us pull together from a department standpoint. So those two items moved under there, and then in turn we moved out our environmental health and our child care licensing out of our clinical services. I can't say that they were ever a natural fit, but that's where they had landed for the past several years, and those have moved into our community health outreach and planning division. So again, we felt like it was the most logical fit and where they felt the best. So those are the main changes that you'll notice. I'm just going to briefly go through our divisions and give you a very high overview of the work that they do. So the finance and admin division, this is Edith and I's areas. So not only the budget that you're hearing presented today, but essentially every budget that is put together in the health department comes out of that area for every program that we run. Our purchasing, our quality improvement, our accreditation, our electronic health records. So things that are very global and really encompass our entire department are what come out of these divisions. Our family health division, which is Missy's division, this is where our home visitation programs come out of, our prenatal classes, our WIC program, our fetal infant mortality review. So anything dealing with families with young children essentially is what we run out of here. It's a large program, or a large division, lots of programs. Our clinical services, as I mentioned, this is where our COVID-19 response is now residing. But in addition to that, this is our STD clinic, our immunizations, our communicable diseases, our TB runs out of here, and of course our family planning, which is our newest, comes out of clinical services. Health protection, this is our environmental health and our child care licensing teams. And so our child care licensing team, this is regulated through the Kansas Department of Health and Environment. So this is our team that does all the initial inspections for the child care providers. For those that are wanting to start a child care up and to get them going, they have to have that initial inspection. They do all the annual inspections that are required, and then also they handle all the complaints. And this is for every licensed child care provider here in Shawnee County, whether it be a home or a center-based. And our environmental health team is dealing with any nuisances that come up. They also help with if there was to be a rabies quarantine. They do our septic licenses, things of that sort. So they are literally out in the field every day. So Craig got the opportunity, and he can vouch, they are literally in fields, checking on wells and things of that sort. So very important work that they do. And right now, we're under mosquito surveillance, and they also do that for us. So our community health outreach and planning, this is where we do our community planning. So this is where we are looking at the community health needs assessment, the community health improvement plan, trying to organize our community partnerships, do some strategic planning as far as who will be able to help carry out the work, what we can do to convene that. It also is our emergency preparedness and medical reserve corps. So the emergency preparedness helps us prepare for any disaster. We do tabletop exercises and different drills throughout the year. A recent example of the work that they did in our region is the Marshall County tornado that came through, and that affected their actual building for their local health department. So making sure that they had vaccine storage was a component of that that we reached out as a regional partner. It also includes, of course, our health promotion and our public information and media. We are actively recruiting for our community health planner right now. So that's a position that had been housed in here, and then with COVID, it became vacant, and so we hope we're close to landing on our candidate of choice to bring back that will be instrumental in moving forward that work within our CHA and our CHIP. Strategic plan, again, you received a full copy of this, so this is just a very high-level overview, but of course, this is one of our guiding documents for our department. And so when we put this together, we are looking at the work that we're actually doing in the department, the services we're providing. We're also looking at that community health needs assessment, the community health improvement plan, and how best can we fit into that, whether it's us doing the actual work or is it us helping to align partnerships so that that work can move forward. Currently, we are in the middle of our 5-year strategic plan, and so there were no large overarching changes made to this. The biggest changes were in the actual action steps, things that we were able to accomplish, or there may have been a change in who was responsible for that. But this is truly reflective of our work. Our goal with our strategic plan is for every employee to be able to see how they fit into the strategic plan and not be left to wonder where they fit into the work that we're doing. A couple of accomplishments that I just wanted to call out. One that we're all very proud of is our family planning clinic opened. Of course, you all were able to join us for that grand opening earlier this year. This was truly a labor of love, us being able to pull 3 years of work to get this finally up and running, but I'm very happy to report it is. We're seeing clients each week in this. We've got a mid-level provider hired. Things are going. The state's very happy that for a community of our size, we were able to bring this to our community to meet our clients' needs. And I listed a couple of collaboratives up here. I feel like these are accomplishments just because these were collaboratives that were established really in response to the pandemic, but they've continued beyond what that initial establishment was for. And so we had a hospital collaborative and a school collaborative, and plans to continue those collaboratives to really look at the work that we're doing. These are not new partners, I would say, but partners that we haven't always formally been at the table with. And so determining what they're doing and what we're doing and how best we can work together. And so I'm really proud of these collaboratives, and I think the team behind me would agree with that, and keeping that work going. Okay, a couple of new positions that I wanted to draw your attention to. So there's a grant writer. You'll note up here it was actually approved as part of our budget last year, but it was never filled. And when I look back and think why it wasn't filled, I think there was just a myriad of things that came about that we weren't able to move that position forward. We are in a much better place now to be able to move that position forward, knowing really what the work we would want that grant writer to do, where that grant writer would be housed and reside under at the health department. We continue to struggle with knowing grants that are available, and if we do find out that they're available, the turnaround time is so quick that then we struggle. You're looking at the grant writers right here. And so having somebody who is dedicated to go out to search for grants that are available for us, and then I view grant writing as a pretty specific ability to do, and hopefully being able to enable us to apply for more grants on all levels is important. The second one that I listed is a data analyst, and what this is would be really a reclassification from our second epidemiologist that we had. Over the past few years, we have had our second epidemiologist position filled. But in meeting with the team, it was decided, and our current epidemiologist, that this position would really be more beneficial than a second epidemiologist. We wanted somebody that would be able to do more of the data pulls and the data scrubbing, and really having it ready for the epidemiologist to do. So somebody that would be working directly under our epidemiologist. So those are the only two positions at this point that we have as new positions in our next year's budget. With that, I'm going to turn it over to Edith.
Good afternoon, Commissioners. Edith Gaines, the Finance Officer. I will be going over the remainder of the slides, and unfortunately, I just don't know how to make numbers fun, but we'll get through this. Okay. This way. Okay, here we go. Okay, so for 2023, our total budget request is $8,463,663. This is an increase in total expenditures from 2022 of $349,346. So for the 2023 budget request, the personnel budget represents 67% of the total local health department budget. The personnel costs for 2023 have increased by $91,249, which includes our wage increases. Previously, the past 5 years, we have asked for the same tax allocation since 2017. This year, however, due to wage increases, program income dropping, and indirect costs we owe to the county raising, the health department is requesting a 32.65% increase in tax allocation and a 4.13% increase in our overall budget.
Edith, can we go back to that slide? I apologize.
Sure. Yes.
Can you walk through us, you have a note on the bottom of that slide. Program income included $1,148,867 in reserve funds from COVID-19 grants, but didn't we also draw from our reserves in 2022?
Yes, we did. That $1,148,000 was our reserve funds that we had budgeted for last year.
Okay.
Well, for this current year, 2022.
So, remind me, why were we spending down $1,148,000 from our reserves?
Well, the COVID-19 grants just don't cover all of the expenditures we have, like some personnel or programs just don't qualify for that revenue stream.
So, again, if we talked about it in 2022 or 2021, I may have blanked it out over the last year, a lot has happened, but was this planned that we were going to overspend by that much?
Yes, it was. That was in our 2022 budget that we submitted in May of 2021.
Okay. And then going into this year, we've continued to dip into more reserves, haven't we?
Yes, we have.
Okay. And do we know why? Was that planned as well?
It was not as much as we had anticipated in 2021, but it's several different reasons. Again, some of it is due to reduced income. So, for example, with COVID-19, we stopped giving our regular vaccinations, and we were just doing testing, but we were not billing for any of those services. We had stopped billing for MCH services. The WIC staff, they had stopped doing some of their services and had transitioned to helping with COVID-19 duties. So we really did have a significant drop in our billing revenue. We had grant revenue, but not our regular income that we bill for.
Isn't this putting us on a track to really deplete almost all of our reserves?
Yes, it is.
Okay.
Yes.
Commissioner?
Yes.
I do have here the information for the 2021 budget. It was budgeted to, at a loss of $547,000. The actual came in at 1.1 million.
So our actual loss was double what we had budgeted for? Okay.
Yes.
And is that just, I mean, mostly due then to COVID overruns?
Some of it is that, probably a majority of it. Some of it is our salary increases, which I do have a slide on that a little later. And then some of it is our indirect costs that we owe to the county. So we had budgeted $350,000 for 2021 and 2022, and that rate has gone up, but that was not budgeted.
What's an indirect cost to the county?
So I don't know, Betty can probably help explain that, but it's services that county provides us, like the counselor's office, audit, finance, provides services to us.
We have a company that we provide them information. They do a study for those departments, and really mostly just solid waste, who's an enterprise fund, health department, who uses all of the county services, the accounts payable, our office, the IT department, all of counselor's office, all of those services they use. We charge them an indirect cost, so then their fund is actually reflecting what the cost would be since they are separate. And we charge that through an indirect cost. And this consultant actually comes up with the cost that it would cost them if they were operating independently.
But we don't do that for any other department?
Because it's part of the general fund. These are departments that are not part of the general fund.
And so if the health department was to be included under the general fund,
Yes,
then they would not have that cost?
that's correct.
Okay.
Yes.
And in the past, they were separate due to them being a federally qualified?
Yes, when they were a federally qualified health clinic, they were required to have their own reserves, so they were in a separate fund, and they actually had to have an audit just on what was the health agency at that point in time. So they were required to have their own reserves, have their own audit. Since we no longer have the federally qualified health clinic, then there's no longer that requirement. So we no longer have a separate audit just of the health department.
It might be prudent then to look at whether or not they should come under the general fund as opposed to being where they're at.
Well, I would have been asked that question a couple of different times and have done a little research. At this point in time, I do not see that there is a reason they have to be kept separate anymore. Now, right now, the health department has all of their grants that flow through their fund. If they were transferred to be under the general fund, they would be a department under the general fund, like all the other departments. But all the other departments that have grants, whether they're state or federal grants, those flow through, all the state grants flow through one fund, the federal grants flow through another fund. So we would change, that would be changing that too. Those grants would also flow through the grant funds and not the general fund.
Might be something for us to look at. So, okay, I apologize, Edith.
Yeah, that's all right. Yeah, okay. So my next slide is on our aid to local grant award comparison. And this is based on the state fiscal year from July 2022 to June of 2023. So we saw an increase of $65,458 in our aid to local grant awards. This is due to increases in the state formula by $53,357, chronic disease risk reduction by $11,493, and then our FEP local by $608. And so our aid to local grant 5-year comparison over the last 5 years, we have gained an increase of $173,644 in funding from our aid to local contracts. Let me see. So the Health Department requested $2,367,348 in aid to local grants for state fiscal year 2023, and we have been awarded $2,185,739. So this is a difference of $181,609 less than what we requested. And then this is our aid to local grant state fiscal year, year-over-year comparison. So year-over-year, the Health Department grants had $3,187,936 in awards for fiscal year 22, compared to being awarded $2,185,739 in fiscal year 23. So we actually had a $65,458 increase in funding, because a lot of the funding we received in 22 was one-time COVID grant funding, and then we had some of those funds carry over to 2023. So if I kind of deduct those COVID grants, we had an increase in our other funding. And then this slide is just a comparison of all of our grant funding, including like WIC, Medicaid match, and our ECBG, based on our county fiscal year or calendar year. So for our overall grants, we have a $545,169 increase for the Health Department. And our only new grant for 2023 was awarded by the City of Topeka HUD's Community Development Block Grant in the amount of $565,659 for COVID-19 response and recovery efforts. Okay. So this year, this is a new slide that we've added. This is a 5-year employee wage and benefit comparison. So our wage increase per FTE over the last 5 years have been less than 1% per FTE. The proposed 2023 budget request shows an 8% increase based on the current wage study. From the original compensation wage study in 2016, we have absorbed all 3 of those implementation years' costs. Just from this slide, from 2019 to 2023, our wages and benefits have increased by $1,009,853. This slide is also new this year, so this is a 5-year indirect cost comparison that we had talked about earlier. So the Health Department's indirect costs received from grants decreased over the past 5 years, but they are expected to stay consistent for 2022 and 2023. And I don't know if you remember, a couple of years back, KDHE had a major change in our indirect costs that they would reimburse us. They capped us at the amount that they get reimbursed from the federal government. So for 2022, our rate is 13.8%. Last year, it had been 15%. So we're not sure what it will be yet for 2023, but we expect it to stay around that 13 to 15% range. And then the indirect costs that we owe to the county increased by 41% in 2021 and an additional 1% for 2022 and 2023. And so this is my final slide. So we just kind of like to do a comparison of our budget to the overall county budget. And of course, this is based on the 2022 budget from last year. But, so for last year, the county's 2022 budget was $118,532,628. So the Health Department's 2023 tax allocation budget of $3,194,672 would represent 2.91% of the county's 22 budget from last year. And then our Health Department overall budget request of $8,463,663 is comprised of 38% tax allocation, 58% grants, and 4% program income. So that would be on the graph in the lower left corner there. So our total 2023 budget is approximately 6.8% of the 2022 county budget from last year. And that's the final chart in the lower right corner. Okay, and so that concludes my presentation.
One thing just to clarify for the commission, because I saw some looks. In the one slide about the grant writer position that they wanted to add, it said that it would have been approved in 2022. It was included in their budget, but it has not come to the BCC for you to approve the position. You know, the budget is the funding source, but the position still has to come to you for you to approve the position. So I saw a look and like, I don't remember that being on there.
We had
Thank you,
also
Betty.
talked at one time about having a countywide grant writer also.
We did. You and I have talked about
Yeah.
that, yeah. So to clarify that, I had a couple questions though. The Gage House facility.
Correct.
Since you did away with that division, is there still a need to have that Gage House building?
Well, I would like to say no, but the problem is that we have nowhere else to put those staff. We are over capacity probably at 10th Street, to be completely honest. They would fall under Carrie's division, and we just really, we don't have the additional space to house would be 4 additional staff, is that correct?
Yes, right now.
Yes, right now, 4 additional staff. So I wish that we could move them into 10th Street, that would be ideal, but there is not room at 10th Street for 4 more staff.
Then on the aid to local grant, you said that you received $181,000 less than you requested. So then will you cut your costs by that $181,000 to offset that reduction?
Well, we do always look for ways we can, I guess, attain cost savings, but a majority of that cost is going to be for salaries.
So you don't really match the grant income with the expenses? It doesn't zero out?
If we can, we would move those expenses to another grant, or depending on which program it is, we do have some, what we call our non-grant funds, which is basically using tax allocation, program revenue, or our reserves.
Mr. Chairman? Edith, just processing this here, as we're talking about the budget. If we budgeted to take out $500,000 from our reserves, and then we wound up taking out $1 million, and then we budgeted for this year, knowing that there would be some drawing from reserves, and we're drawing more than that, are we working on developing a plan to present to the commission on what is going on and where our expenses are? The expenses, I mean, we said salary, we said fees to the county, indirect services, But I feel like I really would like to have something tangible to look at to say, where is the unexpected expense coming from? And especially when you're looking at $1 million increase for next year, and if that amount's not funded, or even if that amount is funded, if you continue the health department on the trajectory that we're at, Teresa's going to be faced with laying off employees and cutting programs. We can't continue to go into reserves the way that we are. There won't be reserves. And so I think we're coming up on a hard point to where we either need to get a handle on the finances or cut programs.
Yes.
That's just a concern I have as a commissioner.
Yes, and that's understandable. We actually do have a meeting with Audit Finance tomorrow to discuss a plan. But I don't think it's so much unexpected expenses other than our air conditioning unit has failed, I think, the past 2 years in a row. But we have been absorbing our wage increases from the wage studies since 2016, as well as, like I mentioned before, that our revenues have decreased because we aren't maybe billing for all the services that we could be billing.
What about our wage increases that we just allocated for now? I mean, if we were still catching up from 2016, we're going into more wage increases now for next year.
Yes, we are.
Edith, do you happen to know what percentage of your wages are reimbursed from grants?
I'd have to get that
Because
calculation.
that should be absorbed by the grants.
Yes. And like we do have WIC that covers 100% of their costs, but we don't have any others that cover 100% the way that WIC does.
Okay. Just if we can get something back to the commission, looking at where those expenses are coming in at or what's going on, that'd be great.
A couple of things that I just wanted to make mention of. So one thing, obviously, 20 and 21, we're busy with COVID. This is a new year. COVID's here to stay. We're figuring out this is what it is and how we're going to manage it. But we have been working internally to start looking at what are we charging, what are our reimbursables, things of that sort. And, I think we've uncovered that some things haven't been looked at, honestly, in over a decade. And so trying to go back and look at how did we determine charges and what is allowable for us to bill for, and, what could we be reimbursed with for insurance. And so that's going to take us time, but we are slowly starting each division and looking through some of that. So when I mentioned the operational efficiencies, we have to dig back to those square one. And so we know costs have gone up, and so if we're still charging the same rates as 10 years ago, we know that that's probably not what we should be doing. So looking at that piece for sure. I had something else, but now I've forgotten what I was going to say.
If I may add one other thing. I was going to say, I know in the past our culture has always been we provide services for the good of the community health, whether we could afford to do that or not. We underwrote the cost and we provided those services, and we did see a lot of that last year with COVID-19. Even though we did get quite a bit of COVID grant funding, again, all costs weren't necessarily covered by those grants. And now that we're coming out of the pandemic phase and people are going back to their normal duties, we still have this grant, the COVID grant funding available to spend, but these staff, we just can't support them with that line of funding. We have to find new lines of funding. So
I thought of my other comment I wanted to make. Betty, I think you asked about the aid to local. And so it's slide 14, and so you'll notice the variances. The biggest variance we had is in our family planning grant. And so we did ask for the scoring rubric for that. Again, this is really our first year we understood why we weren't a lot of the money that we'd requested, but that will be an ongoing conversation with the state. And so determining if this is a formula that they use, I think it's important for us to understand some of the aid to local grants do use formulas. And so yes, you want to write a good grant application, but if it's based on a formula, we need to understand that. And so Carrie and I haven't had a chance to get that. We just got it back, and it's a pretty lengthy document, the scoring rubric for that. And that's our biggest variance that you'll notice in our aid to locals this year.
Teresa, how many open positions do you guys have right now?
Yep.
And do you have any that have been open for like a really long time?
We sure do. Yes, we have, let's see, I'm not going to have all these counted. Well, not all of these are 100% open. I would say we have roughly almost 15 positions open. Our biggest need remains for nursing. We've got one of our nursing positions that's been vacant, it looks like, since late August of 2020.
Oh, wow.
Yes, so that's in our Nurse Family Partnership Program. We actually have 3 vacant positions. They require a Bachelor's of Science in Nursing, so that is very specific for that program of what they require. But yes, we have those. We've got a social worker that's been vacant a little over a year. We have our Health Information Management Specialist position that's been vacant just over a year. That's a very needed position. Yeah, those are, but we've got a variety of them.
So when you have a position like that that's been vacant for 2 years, I mean, what are you doing to provide those services now? I mean, are you providing those services or?
On a very limited basis. So normally the Nurse Family Partnership Program would serve, approximately 75 to 100 families, and we only have one nurse that's able to provide those services right now. So our community is missing out on this program because we aren't able to provide those to as many families. So the families that we're serving are getting the program, but we're definitely not reaching as many families as we want to.
Chair, I was looking at just some of these line items in here, like medical supplies. It went from 32,675 to 179,752. It's a change of 147,000. What causes such a huge jump in something like that?
So some of that is going to be maybe PPE gear for the staff. I don't know, the vaccines, is that a different, that's pharmaceuticals? Okay. But yeah, medical supplies, it could be anything from Band-Aids and, cotton swabs to the gowns that they wear over their clothes, and they have like booties they put on their feet, the rubber gloves. Just various sorts of gear that they need. I know we just started family planning, so that program needed to gear up and get stocked up. So there was a lot of purchases for family planning.
Did that come under program supplies and materials, or is that under medical supplies?
Some of it would have been medical supplies. There may be have been a little bit under program supplies.
I noticed Reynolds took quite a jump too. What are we renting that took such a $68,000 difference? It says some space for vaccine testing.
Yes, that would be our site box that we have. It's across the street from the health department for COVID-19 testing.
We don't currently, are we still doing that?
Yes, we are on a daily, well, no, 2 times a week.
Yes, we still offer the COVID testing. I'm not sure if part of our vaccine at Ag Hall would have been included in that line item that you're specifically referencing or not.
This is for 23.
Oh, 23.
Yeah.
And you said under rental, sorry.
Right.
Wasn't, I thought that site box was grant funded.
Well, can I make sure I understand this? Because that was kind of my exact same question I had about something. So this budget, I mean, this $8 million, that includes your expenses that are reimbursed through grants and your tax allocation amounts, right? So even if it is grant reimbursed, it appears on the bottom, but then there should be revenue up on the top
Revenue on
part
top.
that would also be for that. Am I understanding? And so I have another question when you're done with that, just because I wanted to understand just some notes to make sure because I thought that was right.
And I think, Commissioners, I think the revenue I have, that we've put that as your third page in there. I think the two top pages are the expenses and the third page is the revenue. So that includes their grant revenue they receive.
Okay.
Yeah, sorry, on my spreadsheet.
So
it's
page
above.
1 and 2
Yeah.
include everything, grant funding and,
Yes.
so.
See, and that's why I was talking about it's different than other departments that are general ledger departments. In those, the expenses you would see are only the ones that are paid for by the general fund. Any grants are outside of that fund.
I would just clarify, I'm sorry, I don't have the line item in front of me for the rentals that you asked about, Commissioner Rapon, but yes, we do offer COVID site testing. Our agreement with 501, it's $500 a month is what we pay for our land agreement with them, and then a small amount is also for the rental of the site box that is actually on their land.
This is showing $68,000.
And all it says is
$777.
ELC space for vaccine testing. I mean, if you want, there's a notation.
Yes, so the ELC would be it's COVID grant funded.
Yeah, so do you mind if I ask a question?
Please.
Just my question was down on the medical supplies and on the medical supplies line. There's the budget last year was, or for the current year is 32. The expenses in 21 were 25. And then the budget for 23 is at 180,000. That's what I think Commissioner Rippon was saying. And then the comment on the side was that that's because 2 grants ended. And so you're going to have to use tax allocation money. But regardless of what your funding source is, that still shows a $150,000 increase in that expense. And so do you know what that increased expense would be? I think that's what Commissioner Rippon was trying to say, regardless of the funding
Right.
source.
Yeah, one grant that comes to mind, I think, is our IAP4 grant. I think we have medical supplies in that particular grant, which is, I consider that kind of like a generic line item for whatever type of medical supplies that we would need.
And these are medical supplies you did not have in 21 or 22?
Correct.
So we're going to buy more supplies because we have a grant to pay for them?
If we needed it, we might not actually spend all of that. We end up doing a lot of reclassifications of expenses to other line items if we're not spending it. But we, I guess, are still in this phase of, like, for example, last year when we did the budget, we didn't know, like, how long is COVID-19 going to last? How much supplies will we need? We get these surges in the summer and the winter, and so we try to plan ahead as best as we can, not knowing if we will actually need those supplies. We figure it's better to budget for them and have that available than to not budget and not get any new funding stream.
So that's medical supplies, then there's program supplies and materials, which is similar. It was in 21, it was 14,000, 22 is 16,000, and then this year is showing 156,000.
Yes, I would have to research that. I know with the addition of the infectious disease division, that did increase line items like that.
But you had that in 21 and part of 20, right?
Right.
I'm just trying to figure out why the spike in 23 was all I was asking about.
Right, yes, and I can go back to the office. If I can look at the Excel spreadsheet, we can pinpoint which programs make up the number on the summary page and get you that detailed information.
Just to clarify, Betty, you were asking about program supplies and materials,
Yeah.
is that correct?
Uh-huh. Yeah. Yeah, it's just has a similar
Program.
large increase. That's 50346. Yeah.
It looks like that's coming out of your Division 473.
Yes, so that is our HUD COVID-19 grant from the city of Topeka. It could be testing kits. So for the site box and for Gage House, we have to purchase kits. So during COVID, through 2020 and 2021, those were provided to us free by the state, and now we have to purchase those.
Your costs on Gage House, what costs are you paying there?
We don't pay for Gage House. That's, I guess, loaned to us by Parks and Rec.
Well, I think I would assume you pay utilities and pest control and a copier and insurance.
Yes, yeah, those would be considered program costs for what was formerly the Infectious Disease Division is now the Infectious Disease Program.
Do you have a monthly amount that you're paying? Or can you get me a breakdown of what the monthly amount might be?
Yes, we can get that for you.
I mean, Mary Thomas was just here talking about how this USD 501 granted to CRC another school for them to manage, and that being the former Stout School. And depending on what your cost may be, it may be more economical for the health department to be in the community working with CRC, freeing up some of your space. Again, what the cost may be, but in order for us to have that conversation, we need to see what your costs are actual at Gage right now.
Yeah, because space is a premium in Gage Park right now.
Yeah.
I mean, they're looking for parking lots all over the place. And
So, I mean, CRC is managing the property in High Crest, they're managing the property in Oakland, and now they're managing the property at Stout. So those are three different facilities, all in the communities that you're already working in and with.
And then this ELC space for vaccine testing. We're paying a lot for that, it appears.
That's what we were talking about the rental expense. I think you were going to look in to see what that was, right?
Yes.
Yeah,
Yeah.
that's a lot.
Any other questions? We are over time.
I have no more. But if we can just get some of those feedback on those points.
Absolutely.
All right. Thank you very much.